Hello to everyone. I'm Dr. Osman Kučuk from Center for Dementia in Sarajevo, Bosnia and Herzegovina. My pleasure is to be here today with all of you. My topic is demography, migration, and COVID-19 impacts on life habits and housing requirements of families, people with dementia in Southeast Europe. After a few decades of socialism, societies of the Southeast Europe in 90s of the 20th century have changed political order and economic system. The vision of changes was better society, more rights and opportunities for individual, freedom for all and in everything. In mono-ethnic countries, we could saw destructive regimes where people could not wait better life and they live on the West. In multinational countries like former Yugoslavia, came to total destruction the all achievements of society and creating the national countries. They rapidly severed ties with past and set off into the future. But force took their toll. These processes triggered migrations of young and people in middle age due to high level of unemployment, uncertainty about future, low standard of life, and etc. Today, generations that had run processes in 90s live a sad years of their lives without right support, children's and grandchildren's, and they live alone. As the outcomes after 30 years, we can see what is really changed from 90s last century. Average age of the population has uniform growth, and in 2030, average age will be 47. The last, on this slide, we can see very significant data. Generations 1948, 1953 has 225,000 persons, or almost 50% the total number of people 65 plus. It shows abruptly increase of number older adults. Today, that generation is 8 years older and raised percent of population of 65 plus in total population. Fresh data for Canton Sarajevo shows how numbers of older adults have growth. Sarajevo, as capital of Bosnia and Herzegovina, Canton Sarajevo as the richest place in Bosnia and Herzegovina, with higher percent employers, should be younger because of quality of life in Sarajevo, provide the best for young, educated people. But obviously, it is not case. 17% of older adults in total Sarajevo's population represent a devastating fact that other smaller areas and rural areas have a still older population. This fact calls for an urgent transformation of the health, social, educational, transport system and show needs for urgent adaptation of city to needs of older adults and people living with dementia. When DESA 2015 have stated that in period 2015 up to 2013, societies of Southeast Europe will lost more than 50% of population. Data from 2013-2017 shows continuing decline of newborn for 20% and growth number of died in relation with the newborn for more than 50%. That process leads that working population participate in total population with only 50%, and in the same time, older adults will participate with around 40% in total. It will change looks like of society, and the functioning of society will be totally different regarding past. With average life expectancy, increased number of years people live after retirement. Now that number of years is 13. Retirement in Southeast Europe means combat with different diseases, neglect by all, passive life, and more often single life in non-adapted house conditions that makes difficult extend independence. If we take into account the occurrence of dementia after 65, sure, it isn't period of life which people have dreamed the all working life. In support of this statement goes this research by WHO says expectancy for healthy life is increasing, and in 2016 is almost 65 years for males and 70 years for females. It means with retirement comes diseases, with disease and retirement comes neglect. The fact is that Bosnia already lost 8% due to mortality and additional 7% due to migration. And our assumption is that currently Bosnia has 3 million inhabitants with 150,000 people living with dementia. It is a huge number, but realistic because of Bosnia's past and many dementia risk factors that have negative outcome for Bosnian society, and I believe for all societies in Southeast Europe in which do not exist reports and research. Therefore, you can imagine what is pandemic of COVID-19 did in Southeast Europe when reports from developed countries shows a catastrophic rate of mortality to people with dementia unproportional to number of affected. That mortality isn't due to dementia, it is due to neglecting, non-prepared and non-adapted societies. That state justifies report from Canton Sarajevo in 2021 is an increased number of dead due to starvation. But let's see data regarding COVID-19 challenges. This figure shows conditions in Europe, and in table we can see characteristic data from developed and in developing countries. On the first look, we can see this proportion in the numbers of affected by COVID-19 on 1 million. The percent of affected in developed countries like Germany, France, or Austria is less than 0.1%, while in developing countries, that percent is since 0.4%. Rate of death is incomparable larger in developing countries than in developed countries. It can direct direct us on inappropriate system of healthcare regarding using of inappropriate therapies, organizational issues, regarding with solutions to people with dementia or insufficient promotion of vaccination, and in relation with vaccination by the system offers solutions according with the needs of people with dementia. Also, it could direct us to inappropriate social system with no support to people with dementia that lives alone in their homes, or to out-of-date services of nursing and retirement homes. But unique grade is neglecting, which resulted with high rate of death. On this slide, we shall see very important information in regarding with relation toward people with dementia. This slide gives the best description where is dementia in society in Southeast Europe. People with Alzheimer's disease pass through 3 stages of dementia, where each stage takes 5 years, what is in total 15 years. In Bosnia, average duration of disease is 7.5 years. It is the best description on the what people with dementia have to pass and how much is society prepared and supportive to people with dementia and their families and adapted for their independent life. WHO have analyzed the similar data and they gave toward their recommendations. They called this decade of healthy aging, with previous 5 years for preparation. WHO had aware how is difficult and demanding this process. Implementation, I consider, have no alternative because of stated data on this presentation. But what did they recommend to us? It is 5 objectives. The first one is fostering healthy aging, investment in promoting of new healthy styles and habits and raise awareness. The range of expected healthy life must be raised. People have to be as long as possible independent because of lack of caregivers and weakness of social and health system. Second, creating friendly communities, which implies actions in different sectors like housing, transportation, outdoor spaces and buildings in community and healthy and etc. To people must be adapted environment and equipment. Third, aligning healthcare system for access and using for older adults and people living with dementia on the all levels of health protection. Fourth, developing a long-term care systems that can support people with dementia and meet their needs and help to their families to keep themselves, lives and own habits as well. Fifth, improving measurement, monitoring and research on healthy aging. That means continuous investment after establishing of services or system and constantly improving and aligning with the new recommendations. After we identified statistical data of Southeast Europe societies, we need to see how looks like traditional way of life in Southeast Europe, independent in own home and in institution. Mostly people live in own houses that are residential neighborhood with narrow streets where there are days when it's very hard entry or deliver something. In the neighborhood, in the picture, it is very difficult to organize support and care. The same goes for people living in residential buildings that are 2, 3, or 4 floors without elevators. Sorry. What's happened? In nursing homes, people do not go to live, but to have medical support. That are places without content, and we saw during COVID-19 bans that nursing homes makes problems and they do not part of solutions, and people inside have worse treatment than prisoners. They pay to be closed and exposed to infectious diseases, in this case COVID-19. It is nonsense. Let's see bans due to COVID-19 and which problems made in normal functioning of society. Normal supply, continuation with usual budget, realization, doing of daily activities or duties, visit to GPs or routine health control, timely reaction in relation to health complications, daily social networking, doing of physical activities or exercises, mental health, access to different services. Let's see what challenges are in dementia care regarding COVID-19 and people living with dementia and which lives alone or with spouse. It is detection and diagnosis of the COVID-19, implementation of COVID-19 protective measures, activities to prevent deterioration of the condition, cases of hospitalization, monitoring person with dementia after vaccination. The societies and system did not find right solutions, and because of it reports are horrible. The mortality of people with dementia in relation with other groups are not proportional in relation with total number of infected persons. Participation of person with dementia in total percent to all dies is over 30%. These are worrying data. Southeast Europe doesn't keep similar records. We saw data on rate of death in Southeast Europe, and we can imagine how much is people with dementia in that numbers. On base of this data, we could say that people with dementia was sacrificial lambs of the non-regulated systems in COVID-19 pandemic, as well as their families. Therefore, every system which want to be dementia-friendly have to imply actions on two files, to people living with dementia and to caregivers. To people living with dementia, the system must be based on the knowledge and skills of caregivers and on person-centered care, coordinated care services by the needs. To caregivers, system must ensure support by community, break and rest, understanding, mitigation from stress, education, how to face with new issues in care of a person with dementia, and a common life with a partner in all circumstances. In that context, Dementia Center Hammond Care from Scotland, United Kingdom, published study about project of dementia-friendly society, which included programs in one center as geographical point and one that is community of interest. Actually, it is service not bonded for place. The general common goals are to support people with dementia to continue to be active and engaged community members while increasing public understanding and awareness. Their findings show that every £1 invested in dementia-friendly society change 4.83 pounds up to 5.16 pounds that society invests in similar but individual activities. The conclusion is clear. Because of stated facts regarding demography of societies of the Southeast Europe, where societies are older, people live longer, youth establish families with one kid or without kids. With migration trends of youth inside states of departures in richer countries, which extinguishes itself demographic fires where older couples and older individuals live alone with no support by community and environment, and with no assistive technologies that facilitate them everyday life, with lack of caregivers due to emancipation of women which exit on labor market in society adapted for population up to 55, that do not recognize people living with dementia and even older adults, and societies which do not meet their needs in social and health sense. Therefore, changes are not choice, it is necessity that must be conducted, and the decade of healthy aging is the right opportunity for that. It implies adaptation these societies in dementia-friendly societies. Because people living with dementia and their caregivers or spouses desire to live together and play with grandchildren, cook with others, and walk with friends, swim and exercise, and be happy and satisfied as well, and in the same time be protect and safe and not to be included, rather they want to be the part of the society. Societies of the Southeast Europe cannot face with this issue alone. We need transfer of knowledge and experience from the countries that have solutions, and in this context, we invite all interested stakeholders to contact us, and that with common efforts, this presentation convert in research and actions. Thank you for attention.